The boy hit the floor before anyone moved. 14 years old, maybe less. Jeans soaked through with blood, one arm bent at an angle that made the intake clerk turn away. He'd crawled through the emergency room doors on his hands and knees, and when his arms gave out, he just dropped, face first, onto the linoleum. The sound was flat and final and wrong. Every person in that waiting room froze. Every person except one. She was already moving before the boy stopped sliding. A nurse in dark blue scrubs, unremarkable, mid-30s, the kind of woman people's eyes passed over without stopping. She dropped to her knees beside him, 2 fingers to his neck, and in the same breath she was shouting for a gurney, calling out a blood pressure estimate, pressing her palm against the wound site with the calm of someone who had done this in far worse places than a Montana emergency room. No hesitation, no wasted motion, like the chaos around her was just noise. Within the hour, that same nurse would be accused of incompetence by the most powerful doctor in the building, stripped of her credentials, and ordered out of the hospital she had worked in for 3 years. And within 2 hours of that, she would be the only thing standing between 47 critically injured people and a disaster that would have destroyed them all. Her name was Lauren Merritt, and nobody at Callaway Peak Medical Center had any idea who she actually was. If this story already has you hooked, stay with me until the very end. Hit subscribe so you don't miss what happens next. Drop a like and tell me in the comments, what city are you watching from? I want to see how far this story travels. Yeah. Callaway Peak Medical Center sat at the edge of Dunmore, Wyoming, the kind of mid-sized city that liked to describe itself as growing. The hospital wasn't large by any measure. 4 floors, 2 surgical suites, an emergency department that handled everything from ranch injuries to the occasional overdose. But it was the only full-service trauma facility within 60 miles, which made it feel more important than its budget suggested. Lauren had taken the nursing position there 3 years ago without much explanation. She'd listed her prior work experience as a stint with a federal health contractor, vague enough that HR didn't press, specific enough that they didn't question it. She had her RN license, her certifications, her references. She showed up on time, did her work, and kept mostly to herself. The staff liked her well enough. She was competent, steady under pressure, good with patients who were frightened. She never complained about the overnight shifts, never called in sick, never made drama, which, in a small city hospital, was either admirable or suspicious, depending on who you asked. Dr. Marcus Drelling had decided somewhere around month 4 of Lauren's employment that it was suspicious. Drelling was chief of emergency medicine. 53, thick through the chest, with the kind of silver hair that photographed well for hospital fundraiser brochures. He had been chief for 11 years and ran the department with the quiet certainty of a man who believed his instincts were always the sharpest in the room. He'd graduated from a program most people had heard of, done a residency at a hospital most people respected, and he talked about both things frequently enough that no one could forget either. He didn't like Lauren. He couldn't have explained it precisely. She never challenged him directly, never went over his head, never made a mistake he could point to. But something about her bothered him. The way she moved through a trauma bay without asking permission. The way patients looked at her instead of him after a crisis. The way she never seemed nervous when he was watching. She's got no background, he told the nursing director Sandra Obi, sometime in Lauren's first year. No name programs, no hospital pedigree. I don't know where she got her training. Sandra had pulled up Lauren's file and pointed out, not unkindly, that the file was clean and her performance evaluations were excellent. Drelling had nodded and let it go, but he'd started watching her more carefully after that. The morning it all broke open started ordinarily enough. Lauren came in at 6:50 for a 7 o'clock shift, changed in the locker room, checked the board. The overnight team had left 2 patients boarding in the hall, a 60-year-old with a kidney stone waiting on urology, and an 18-year-old with an allergic reaction that was mostly resolved. Neither was critical. The department was quiet the way early mornings sometimes were, that brief exhale before the day picked up. She took report from the night nurse, a tired woman named Petra, who handed over her notes and immediately grabbed her coat. 2 in the hall, 1 in Bay 4 with chest pain that's probably anxiety. Nothing hot, Petra said. Oh, and Drelling's already here. He was here when I came in at 11 last night, so I don't know what that's about. Lauren nodded. That was unusual. Drelling didn't typically arrive before 8. She found out why 20 minutes later. There had been a complaint filed. Patient family, Bay 3, 2 nights prior. A man named Galt, who'd brought his wife in with chest pain and felt the response time was inadequate. In his written statement, he'd specifically named the nurse who he felt had deprioritized his wife's care. The name he'd written was Lauren Merritt. She read the complaint summary in the small conference room off the nursing station, Drelling standing across the table from her with his arms folded. "I want to hear your account of that interaction," he said. "Mrs. Galt came in at 11:40 p.m., Lauren said, keeping her voice flat. She was triaged as a 2. I had a septic patient in Bay 1 and an active M1 in Bay 2 at the same time. I checked on Mrs. Galt at 12:10, explained the delay, and she was seen by the physician at 12:35. Her EKG was normal. She was discharged at 2 a.m. Her husband says she waited over an hour without anyone speaking to her. Her husband stepped out to get coffee at 11:50 and came back at 12:15. He wasn't present for the check-in I did at 12:10. Drelling looked at her for a long moment. "Do you have documentation of that 12:10 check?" She paused. One beat. "I charted my assessment at 12:20. The check itself isn't a separate entry." He nodded slowly, the way someone nods when they found what they were looking for. "That's a documentation gap, Lauren. It's a timing gap. The assessment happened. I can only go by what's in the chart." Sandra Obi was also in the room, sitting to the side with her hands folded on the table. She hadn't said anything yet. "Sandra," Drelling said, without looking away from Lauren, "per protocol, a formal complaint of this nature requires a suspension of duties pending review. Correct?" Sandra looked uncomfortable. "If the department head determines it's warranted, yes." "I'm determining it's warranted." Lauren looked at him steadily. She knew what was happening. She wasn't sure she could stop it. "This complaint is going to review, and it's going to clear me." "That may well be," Drelling said. "In the meantime, I need you to hand over your badge, and security will escort you from the department." But she didn't make a scene. That wasn't who she was. She went to her locker, gathered her bag, handed her badge to the security officer, a young man named Felix who looked like he'd rather be doing literally anything else, and walked down the main corridor toward the exit. Some of the day shift nurses watched her go. A few of them looked away quickly. One of them, a travel nurse named Becca, who'd been there about 4 months, said quietly as Lauren passed, "This is wrong." Lauren didn't stop walking. "Yeah," she said, "it is." She pushed through the side exit door into the morning air. It was cold, February in Wyoming, with a wind that came down off the ridge and cut through whatever you were wearing. She stood on the sidewalk for a moment, not moving, just breathing. Her chest felt tight in a way that had nothing to do with the cold. She'd been here before. Not here exactly, but in situations where someone with more authority than sense had made a decision that couldn't be unmade in the moment. She knew what it felt like to be removed from a situation you could have helped. She also knew that fighting it in the parking lot never worked. She pulled out her phone and was considering her next step when she heard it. 3 blocks away. Then 2. Then 1. The sound was specific in the way that anyone with certain training would recognize immediately. Multiple emergency vehicles, not in sequence but simultaneously, a convergence rather than a single response. Ambulance sirens layered over each other. Air brakes. Somewhere behind that, lower and harder to place, the distant sound of what could only be described as structural collapse. Not an explosion, just the enormous grinding noise of something very large coming apart. Lauren turned toward the sound. She could see the highway from where she was standing, the overpass that curved down into the city's west side. Or she could see where it should have been. The upper section of the I-84 connector ramp had failed. Later, she would learn the details. Ice accumulation, a structural assessment that had been delayed twice for budget reasons, a support column that had been flagged in an inspection 18 months ago. But standing in the parking lot at 7:23 a.m., what she saw was smoke rising in 2 columns, the distant crumple of metal, and the beginning of what was very clearly a mass casualty event. Her phone buzzed, then buzzed again. The hospital's emergency notification system. All available clinical staff, MCI activation. Report to department immediately. Estimated casualties, Unknown. She read it twice. She was no longer clinical staff. Marcus Drelling had seen to that about 12 minutes ago. She stood on the sidewalk with her phone in her hand and looked at the smoke.
Us.
The first ambulances arrived 7 minutes after the initial alert. By the time Lauren walked back through the side entrance, she still knew the code. No one had thought to change it yet. The emergency department had already shifted into a kind of controlled panic that she recognized wasn't going to stay controlled for long. Felix, the security officer, was at the door. He saw her and opened his mouth. "You can pull me out after," she said, walking past him. "Right now, you need every person you can get." He didn't stop her. The trauma bays were filling fast. She could hear Drelling at the center of the department, his voice elevated, talking about standing orders and surge protocol. She heard two nurses arguing about where to put patients. She heard someone say the blood bank was being contacted. She heard, underneath all of it, the raw sounds of people in serious pain. She moved toward the sound. Bay 6, teenage male, blunt force trauma to the chest, GCS decreasing. The medic who'd brought him in was still reciting the handoff to a nurse who was writing on her glove because there wasn't time to find a chart. "Restrained passenger," the medic said. But the vehicle rolled, airbag deployed, chest took the wheel column. BP was 80 palp on scene, got a line in, but I'm worried about tension pneumo, Lauren said. The medic stopped. The nurse, whose name was Adrian, looked at Lauren with an expression that combined relief and uncertainty in roughly equal parts. "You're not supposed to be..." Trachea's deviated left. "He's not moving air on the right side." Lauren had her stethoscope on the boy's chest before she finished the sentence. "You've got maybe 4 minutes before this goes to arrest. I need a 14-gauge needle, second intercostal space, midclavicular line. I have to call Dr. Drelling. Adrienne," Lauren looked at her directly. "Call him while you're handing me the needle." Adrienne handed her the needle. The decompression took 30 seconds. The boy's oxygen saturation, which had been dropping toward the low 80s, began climbing back. His color started returning. The medic let out a breath he'd clearly been holding. "Good catch," he said. Lauren was already moving to the next bay. What followed was not a clean, well-orchestrated response. That was important to understand. People later would describe it differently. They'd compress the chaos into something that made more narrative sense. But the reality was loud and ugly and full of near misses. A surgeon named Dr. Petra Vance arrived 20 minutes into the surge and immediately took charge of the surgical queue, which was the right call. She was excellent in the OR. But that left the trauma floor without a clear clinical lead, because Drelling kept getting pulled into administrative decisions about capacity and diversion status, and at some point was on the phone with the hospital's CEO. Lauren didn't take charge. That wasn't what she did. What she did was move through the department the way water finds its level, toward wherever the gap was most critical. A woman in Bay 3 who was showing early signs of traumatic brain injury that the resident had attributed to intoxication. A man in the hallway whose blood pressure was holding, but whose abdomen was rigid in a way that meant internal bleeding nobody had caught yet. A child, maybe 9 years old, who was crying in a corner while her mother was in surgery, and who Lauren sat with for 2 minutes. Exactly 2 minutes, until a social worker arrived. Becca, the travel nurse who'd said, "This is wrong," when Lauren left, worked alongside her for most of it without asking questions. She just watched how Lauren moved and followed. "Where did you train?" Becca asked at one point during a 20-second break while they both restocked a supply cart. "A lot of different places," Lauren said. Becca nodded like that answered something. Drelling found her at the 40-minute mark. He came into Bay 8, where Lauren was managing a hemothorax with a resident named Torres, who'd looked like he was going to freeze up and hadn't, because Lauren had talked him through the first 2 steps until his hands steadied. Drelling stood in the doorway and stared at her. She finished what she was doing, handed Torres the next instruction, and then turned. "You need to leave," Drelling said. His voice was controlled, but there was something tight underneath it. "We have 43 patients, 12 of them critical, and you're 3 physicians short of what you need for this surge," Lauren said. "I've been managing bays 5, 6, and 8 for the last 40 minutes. You are suspended. You are not authorized to provide care in this hospital." Then suspend me again after. She held his gaze. How's your tension pneumo patient in Bay 6 doing? He didn't answer. His name is Tyler, she said. 16. SAT is 96 now. It was 81 when I decompressed him 40 minutes ago. She let that sit for exactly 1 second. If you want to pull me off the floor, you can. But you should know what you're losing before you do it. She watched him calculate. She'd seen that look on other faces in other places. The moment when someone's pride and someone's survival instinct came into direct conflict, and one of them had to lose. He walked away without saying anything. She went back to work. About an hour and 15 minutes after the initial alert, with the department still managing incoming patients, a different kind of sound entered the building. Not ambulances. Something heavier. Lauren heard it before she consciously registered what it was, the rhythm of military vehicles, the specific cadence of boots on pavement moving with purpose. She was in the trauma corridor, and she felt it more than heard it, the way you feel bass through a floor. She kept her hands on what she was doing. The first indication she had that something significant was happening was when one of the intake nurses came back from the main entrance with an expression that Lauren had never seen on her before. The nurse's name was Doris, and Doris was 60 years old and had been working emergency intake for 22 years and was not easily rattled. Doris looked rattled. There are soldiers at the front desk, Doris said to no one in particular and everyone in the corridor. Like actual soldiers. They said they're looking for someone. Lauren's hands went still. She finished what she was doing, tied off the last suture on the laceration she was closing, told the patient to hold pressure, stepped away. The soldiers were in the main entrance corridor when she came around the corner. 4 of them in uniform, combat medical insignia, one of them a woman with the kind of posture that didn't come from a desk job in a rank that Lauren recognized before she was close enough to read the name tape. The woman saw Lauren at the same moment Lauren saw her. For a half second, neither of them moved. Then the officer walked forward, stopped 2 feet away, and came to attention with a precision that made the intake desk go completely silent. Captain Merritt, she said, we got word you were here. The corridor was quiet except for the distant sounds of the trauma bay. Drelling was standing 10 feet away. He'd followed Lauren out or been drawn out by the same thing. It didn't matter. He was there, and he heard the word captain, and he heard the name Merritt, and Lauren watched the expression on his face shift through several things very quickly before it settled into something that looked like the beginning of understanding. Lauren looked at the officer. She looked at the soldiers behind her. She looked at the department around her. The controlled chaos she'd spent the last hour and 20 minutes helping to keep from becoming something worse. She exhaled once. At ease, Lieutenant, she said. Tell me what you've got. Lieutenant Dana Rourke didn't smile. She wasn't the type, and this wasn't the moment. She stood in the corridor of Callaway Peak Medical Center with her hands clasped behind her back and gave Lauren the summary the way she'd been trained to give summaries. Fast, clean, no editorializing. Secondary collapse on the east span confirmed 40 minutes ago. Search and rescue has cleared the immediate debris field, but there are still 3 vehicles unaccounted for in the lower section. Local fire is managing extraction, but they've flagged 3 casualties that need more than what your facility can handle alone. She paused, half a beat. Forestcom tasked our unit to support the civilian medical response. We've got 2 combat surgical teams staged in the parking structure and a supply cache that includes blood product and surgical equipment your hospital doesn't carry. Lauren absorbed this in the time it took most people to blink. Who authorized the deployment? Joint request. County Emergency Manager and the State Adjutant General's office. It went through fast because of who was on the casualty list. Meaning what? Rourke's jaw tightened almost imperceptibly. One of the unaccounted vehicles is a transport contracted by the federal court system. We don't know yet who was in it. Lauren didn't react to that visibly. She filed it. How many personnel do you have? 12 medical, 4 logistics, 2 vehicle operators. We can establish a forward triage point in your ambulance bay if your administration authorizes it. That's going to take 10 minutes we don't have. Lauren looked past Rourke at the 2 soldiers flanking her, both of them watching Lauren with a specific kind of attentiveness that wasn't curiosity, it was assessment. They knew who she was. They were waiting to see what she'd do. Set up in the ambulance bay. I'll handle the authorization. Rourke nodded once. No questions. Behind Lauren, Marcus Drelling had not moved. He was still standing in the corridor with the expression of a man whose internal map had just been handed back to him, with all the roads in different places. She could feel him there without turning around. She'd developed a sensitivity to Drelling over 3 years that was less like intuition and more like the way you learn the sound of a specific kind of weather. She turned to face him. "My teams need access to the ambulance bay and a direct line to your blood bank and surgical coordinator," she said. It wasn't a request. She didn't make it sound like one, but she also didn't make it a confrontation. There was no time for either of them to indulge that right now. "The sooner you make those calls, the sooner we stop losing people." Drelling looked at her. Then he looked at the soldiers, then back at her. "You want to explain what's happening right now?" he said. His voice had lost some of its usual authority. Not all of it, but some. "Later," Lauren said. "Ambulance bay. Can you make the calls?" A long 2 seconds passed. Then Drelling reached for the phone on the intake desk. Lauren went back to work. The forward triage point was operational in 11 minutes, which was not fast by military standards, but was remarkably fast given that they were setting up in a civilian hospital's ambulance bay with equipment that had to be manually staged from 2 vehicles. Rourke ran it like she'd done it 40 times before, which she had. The soldiers moved with an economy of motion that made the civilian staff stop and stare for a moment before they caught themselves and got back to what they were doing. Lauren moved between the inside and the bay for the next 30 minutes, functioning as the connective tissue between the 2 operations. She wasn't running either one. Rourke had the military triage. Dr. Vance had the surgical queue. What Lauren was doing was harder to describe and more important than either. She was reading the whole picture, identifying the gaps before they became failures, redirecting resources before anyone had to ask. There was a moment around the 90-minute mark, when the incoming rate had finally begun to slow, that Becca caught up with her near the supply corridor and just looked at her for a moment. "Captain," Becca said. Lauren glanced at her. "They called you Captain." "They did." Are you active?" "No." Lauren picked up a supply count sheet someone had left on the counter. "Reserve. Inactive reserve, technically. I separated 4 years ago." Becca absorbed that. "How long were you in?" 11 years. "Doing what?" Lauren set down the sheet. "Right now, I need you to check the blood product inventory and cross-reference it with what Rourke's team brought in. We're going to run low on O-negative before the day's over." Becca recognized a redirect when she heard one. She went to check the inventory. The third escalation of the morning came at 9:52, and it came in a form Lauren hadn't anticipated. 2 of Rourke's soldiers came through the ambulance bay entrance with a gurney, moving at a pace that meant urgency, and on the gurney was a woman, mid-40s, civilian clothes, unconscious, with a field dressing on her right shoulder that was soaked through and a tourniquet on her left leg that had been applied correctly but too long ago. Behind the gurney came a man in a federal marshal's uniform, his left arm in a sling made from what appeared to be a torn jacket sleeve, dried blood on the side of his face. He was walking, which meant he was ambulatory, which meant he was not the immediate priority. He clearly knew this and didn't like it. "That's Deputy Marshal Ferris," he said to anyone who would listen. "She was in the transport vehicle. There were 3 others. I don't know where the others are." Lauren was already beside the gurney. The shoulder wound was significant. She could see from the saturation pattern that arterial involvement was possible. The tourniquet on the leg was the more immediate problem. It had been on too long. She couldn't see the initial application time, but from the tissue presentation it was at least 45 minutes, maybe more, and that was the edge of the window. "What's her name?" Lauren asked the marshal without looking up. "Sandra Ferris. She's the deputy in charge of the transport." He paused. The transport was carrying a federal witness. That landed in the corridor like something dropped from a height. Rourke, who was 3 feet away coordinating another incoming, turned her head sharply. "What kind of federal witness?" Lauren asked, still not looking up, still focused on Ferris. "I can't." The marshal stopped. He looked around at the corridor, the staff, the soldiers, the general controlled chaos. "I can't say that here." "Okay," Lauren said. Then find Lieutenant Rourke and tell her what you can tell someone with a security clearance. She looked at Rourke. Rourke. Rourke was already moving toward the marshal. Lauren focused entirely on Ferris. The shoulder wound, on closer inspection, was a penetrating injury, not a ramp collapse injury. A penetrating injury had a specific character, entry pattern, surrounding tissue response, that was unmistakable once you'd seen enough of them. Lauren had seen enough of them. "Adrian," she said, and Adrian appeared at her elbow because she'd been watching Lauren all morning and had started anticipating when she'd be needed. "This injury pattern isn't consistent with the bridge collapse." Adrian looked at the wound, then at Lauren. "What does that mean?" "It means someone needs to call the sheriff's department right now and tell them one of their scene casualties may not be a casualty from the scene." Lauren kept her voice even. "And I need a surgical consult on this tourniquet. Vance is in the OR. Who's her next available?" "Dr. Okafor. He just came out of a case." "Get him." Dr. Nnamdi Okafor was 41 years old and had trained at a program in Houston that took trauma medicine more seriously than most. He came into the bay pulling off his OR cap, read the room in about 3 seconds, and came to stand beside Lauren at the gurney. He looked at the tourniquet. He looked at the wound. Then he looked at Lauren with an expression that was entirely professional and said, "When was this applied?" "Unknown. At least 45 minutes, possibly closer to 60. He put on gloves without being asked. "And the penetrating wound to the shoulder?" "That's why I called you." He examined it briefly. His expression didn't change much, but something shifted behind his eyes. "This isn't a crush injury." "No." "Someone shot her." "That's my assessment." He straightened. "Then we need to notify law enforcement before we do anything else." "Adrienne is already on it," Lauren said. Okafor looked at Lauren for a moment, a longer look, assessing in a way that wasn't hostile, just thorough. She'd worked alongside him a handful of times in 3 years, and he'd always been decent to her, always treated her like a competent professional, which in the emergency department wasn't as universal as it should have been. "You're supposed to be suspended," he said. "I'm aware." "Are you going to leave? Are you going to make me?" He almost smiled. Almost. "Let's get her stabilized and get Vance out of that OR as soon as she's closable." The sheriff's deputy, who arrived 12 minutes later, was named Torres, no relation to the resident, and he was young enough that Lauren initially thought he'd sent his most junior person, which would have been the wrong call. But Torres turned out to be sharper than his age suggested. He listened to Lauren's summary without interrupting, looked at the wound documentation she'd started, and immediately got on the radio with a phrasing that told her he understood exactly what they were dealing with. "I need a supervisor at Callaway Peak Medical, Bay 3, he said into the radio. "Possible 1000, non-accident related, requesting detective response." The marshal, whose name, Lauren had learned, was Garrett, had been sitting in a corner of the bay with his arm in its improvised sling, watching everything with the look of a man doing several calculations at once. When Torres finished his radio call, Garrett stood up. "I need to speak to whoever's in charge of the military team," he said. "That's Lieutenant Rourke," Lauren said. "I know who Rourke is." Garrett paused, recalibrated. "We've been trying to reach her unit for the last 2 hours. The transport vehicle. The collapse may not have been an accident." The corridor went quiet in a very specific way. Not silent. There were still patients, still sounds from the trauma bays, still the low noise of a hospital that hadn't stopped functioning. But the 5 people standing in that immediate space went still. "Say that again," Lauren said. "The bridge section that failed, it was flagged in a maintenance report 18 months ago, which is public record, and there are people who knew this transport was using that route today." Garrett's voice was measured, careful. "I can't tell you more than that without clearance, but the people I need to be talking to right now are the people who know who she was carrying." He looked at Rourke. Rourke looked at Lauren. Lauren looked at Garrett. "How many people knew the route?" "Not many, which is the problem." Marcus Drelling found Lauren at 11:15, when the incoming surge had finally dropped to a manageable rate, and the department had shifted from crisis mode to high-volume management. Still overwhelming by normal standards, but no longer the edge of catastrophe. He came to her deliberately. She could tell from the way he walked that he'd been working up to this for a while. He stopped about 6 feet away, which was further than necessary for a conversation, and crossed his arms, then uncrossed them, then put his hands in his coat pockets. "The hospital administrator wants to speak with both of us," he said. "I figured. This afternoon, 3 o'clock. "Fine." He was quiet for a moment. Around them, nurses moved, a phone rang. Someone called out a patient update. The normal sounds of a department that had survived something difficult. "The patient in Bay 6, Drelling said. "Tyler." "I know who Tyler is." "His parents arrived. They were asking who saved him." He paused. "The medic told them it was you." Lauren didn't say anything. "He would have died," Drelling said. It wasn't an apology. It didn't quite have the shape of acknowledgement either. It was something in between. A man who was good at certainty being forced to hold uncertainty and not knowing what to do with his hands while he did it. The tension pneumo. "He would have—" "Yes, us," Lauren said. "He would have." Another pause. "I'd like to understand what your background actually is." "I imagine you would." "That's not an answer." She looked at him directly. She'd been careful all morning not to do that. Not out of deference, but because she'd been focused on the work and there'd been no reason to. Now there was a reason. "No," she said. "It's not." She walked away. She found Rourke at 11:30 in the small conference room off the main corridor, which had been converted into something resembling a command space. Someone had brought in a laptop and a secured satellite phone and a situation board that had hand-drawn notations on it in the particular shorthand that military people use when they're working fast. Garrett was there too, his arm properly splinted now by someone on Rourke's team. He was on his own phone. He put it down when Lauren entered. "The other 3 occupants of the transport have been accounted for," Rourke said without preamble. 2 are at St. Marcus County Hospital in Hale Creek. Minor injuries. 1 was not in the vehicle when rescue reached it. The temperature of the room dropped. "The witness?" Lauren asked. "We think so," Garrett said. "There's no body at the scene. That's either very good or very bad." "What's the case?" Garrett and Rourke exchanged a look. It was a quick look, the kind that happened between people who'd already had the clearance conversation and were now deciding what to do with someone who wasn't in that loop. "You need to know who you're asking me about before I tell you," Garrett said. "The people connected to this case have significant reach. I don't say that to be dramatic. I say it because 2 people who were scheduled to give testimony in this same proceeding have had serious accidents in the past 6 months." "What kind of accidents?" "The kind that don't look like accidents until you look closely." He met her gaze. "The same way a bridge inspection report that's 18 months old suddenly becomes relevant when you find out one of the federal marshals on scene was shot before the vehicle went over the barrier." Something cold settled in Lauren's chest. She'd felt that sensation before, in very different places. It was the sensation of a situation revealing a second layer that hadn't been visible from the outside. "They knew she'd survived the collapse," she said. "The shot was to make sure she didn't." Garrett didn't confirm it. He didn't have to. "Who ordered this transport?" Lauren asked. "That's what I'm trying to establish," Garrett said. "The routing was changed 48 hours ago. Someone moved the pickup time and the route, and that information wasn't accessible to most people in the chain. But it was accessible to someone." "Yes." Rourke stood up. She'd been sitting in the only chair with armrests, which she'd taken without apparent thought because she was the kind of person who took the chair with armrests in any room. "There's something else," she said. "We've been pulling documentation since we arrived. Hospital records, patient files, routine intake stuff as part of the medical response coordination." She paused. "We found a discrepancy." "In what?" "In the complaint file that was used to suspend you this morning." Lauren went very still. Rourke placed a printed document on the table. It was a screenshot of an internal hospital record. Lauren could recognize the formatting of Callaway Peak's electronic system from 3 years of looking at it. The complaint was filed in the patient family portal at 11:14 p.m. on Tuesday. But the system log shows the patient, Mrs. Galt, was discharged at 2 a.m. Wednesday. The complaint was filed before she left the hospital. Lauren looked at the document. "That's possible if someone helped her file it from a device in the hospital," Rourke continued. But the geolocation data on the submission shows a different IP address than any patient terminal or visitor device. It matches an internal administrative access point. She paused. Specifically, a terminal in the Chief of Emergency Medicine's office. The words settled into the room. Lauren thought about Drelling standing in that conference room this morning, his arms folded. The way he'd said documentation gap as if he'd been waiting to say it. The 11 months she'd been watching him watch her and wondering why. He filed it himself, she said. The metadata says the submission was created and staged 3 days before it was sent, Rourke said. Someone built a complaint and waited for the right moment to deploy it. Lauren was quiet for a moment. She looked at the document on the table. She was thinking, but not about what most people would have thought about in that moment. The injustice of it, the anger, the personal cost of what had been done. She was thinking about the timing. 3 days ago. Why 3 days ago? What was happening at this hospital 3 days ago? She asked. Rourke and Garrett looked at each other again. We'd like to know the same thing, Rourke said. Sandra Obi found Lauren in the hallway at 12:30, and from the expression on her face, she'd been looking for her for a while. Sandra was not a dramatic person. She was organized, fair, occasionally bureaucratic in a way that frustrated the nursing staff, but was generally forgivable because she was also honest. Lauren had always considered her the most reliably decent administrator in the building, which wasn't an especially high bar, but was something. I heard, Sandra said. She didn't specify what she'd heard. It didn't matter. Enough had moved through the department by now that the general shape of the story was visible to anyone paying attention. Which part? Lauren asked. All of it. Sandra stopped walking. They were in a side corridor, relatively quiet, a supply door on one side and a window showing the parking structure on the other. Lauren, I want you to know that I didn't see it, the complaint. I should have looked more closely at the timestamp sequence, and I didn't. You don't have to. I'm not apologizing for myself, Sandra said. I'm telling you where my failure was so you know it wasn't complicity. There's a difference. She held Lauren's gaze. I've been nursing director for 9 years. I have sat in that chair while 3 different chiefs used administrative processes in ways that weren't appropriate. I've pushed back on 2 of them. This time I missed it, and someone almost died because of that. Lauren looked at her. Sandra's eyes were dry, but only just. She was a woman holding herself together by the sheer force of 30 years of professional discipline. Tyler would have died, Sandra said quietly. The boy in Bay 6. Without you. Sandra, I know that's not the point you want me to make. I know you want me to understand the institutional failure, not reduce it to one outcome. Sandra pulled in a breath. I do understand that. I'm trying to tell you that I also understand the other thing. Both things are true. Lauren was quiet for a moment. Down the corridor, she could hear the department still running. The volume had dropped another level. Incoming had slowed. The surgical queue was processing. Rourke's team was coordinating with the county emergency manager on the remaining scene work. The worst of it was over. What's going to happen with Drelling? Lauren asked. The administrator is calling a formal review for this afternoon. With what the military team found in the system logs, Sandra paused. I don't think he's going to survive it. He shouldn't. No. Sandra looked at her. He shouldn't. At 20 minutes before 2, Lauren was sitting alone in the small break room near the nursing station, eating a granola bar she'd found in her bag and drinking the worst coffee she'd ever encountered when her phone rang. She didn't recognize the number. She answered anyway. Captain Merritt. Male voice. Older. The kind of deliberate cadence that came from years of speaking in rooms where people wrote down what you said. This is Deputy Inspector Gerald Harwick, Office of the Federal Inspector General. We've been notified of the situation at Callaway Peak Medical Center. Lauren chewed the granola bar and waited. I'm told you've been working with Deputy Marshal Garrett and Lieutenant Rourke on the circumstances surrounding the transport vehicle. I've been working in the emergency department, Lauren said carefully. I was present for some of those conversations. Right. A pause. Captain, the witness who was in that transport, we've had a development. Approximately 40 minutes ago, county search and rescue located an individual in the lower debris field. Adult female. She'd self-extracted from the vehicle, moved roughly 300 meters, and took cover in a drainage culvert. She's alive. She has a broken wrist and a significant laceration to her forehead, but she's ambulatory. Lauren let out a breath she hadn't realized she was holding. She's being transported to your facility now, Harwick said. She's asked us to ensure that when she arrives, the treating physician is a woman named Lauren Merritt. The granola bar wrapper crinkled in Lauren's hand. How does she know my name? Lauren asked. A brief pause on the line. I think that's a conversation she'd like to have in person. Another pause, slightly longer. Captain, I want to be direct with you. This woman's testimony is critical to a federal case that involves organized financial fraud at a level that affects public institutions in 4 states. The people she's testifying against have already demonstrated they'll interfere with this process. We believe the bridge was not the only intervention they planned. He stopped. There's reason to think the suspension filed against you this morning was also part of that. The break room was very quiet. Lauren looked at the granola bar wrapper in her hand. She looked at the terrible coffee. She thought about Drelling's office terminal, about a complaint staged 3 days in advance, about the exact timing of a structural failure on a bridge that had been waiting to fail for 18 months. You're telling me, she said slowly, that someone used a doctor in this hospital to remove me from the floor before the crash happened. Harwick was quiet for exactly 1 second. We're still establishing the full picture, but that's the direction you're looking. Captain, the ambulance should arrive in approximately 8 minutes. Lauren stood up. I'll be at the bay, she said. She ended the call, finished the granola bar in 1 bite, and left the terrible coffee on the table. In the corridor outside, she could already hear movement, the familiar cadence of incoming, the radio chatter picking up, Rourke's voice somewhere near the ambulance bay entrance giving an instruction to one of her team. 8 minutes. She moved toward the sound, and as she came around the corner toward the bay entrance, she almost walked directly into Marcus Drelling, who was standing in the corridor with his phone pressed to his ear and an expression on his face that she had never seen before. He lowered the phone when he saw her. His face was the color of old chalk. Whatever he'd just heard on that call had taken something out of him, not the composure that he usually wore like armor, but something underneath the composure, something structural. Lauren, he said. It was the first time in 3 years that he'd used her first name without making it sound like a correction. She looked at him. She was about to walk past him. The ambulance was 4 minutes out at most, when something in his expression stopped her. The administrator, he started. Then he stopped. He tried again. I received a call just now from a number I didn't... He stopped again. Someone told me that if I cooperated with this afternoon's review, my family... He didn't finish the sentence. In the distance, Lauren heard the first sound of an ambulance siren. She looked at Drelling. She looked at the phone in his hand, the number still visible on the screen. She thought about timing, about reach, about how many layers a thing could have before you found the bottom. Give me the number, she said. He handed her the phone without hesitation, like a man handing something over because holding it had become impossible. She photographed the screen with her own phone, handed his back. Don't delete that call log, she said. Don't talk to anyone about what was said until you've talked to Harwick's office. I'll get you the contact number. Who is Harwick? The siren was closer now. Someone you want in your corner, Lauren said. More than whoever just called you. She walked toward the ambulance bay. Behind her, she heard Drelling say something else. Something low and indistinct. Maybe her name again. Maybe something else entirely. She didn't slow down to hear it, because through the bay windows she could see the ambulance backing in, and she could see Rourke moving toward it, and she could see one of the soldiers holding the bay door open with the precise, unhurried movement of someone who knew that speed now was the wrong kind of speed. And somewhere in that ambulance was a woman who had survived a bridge collapse and a gunshot and 300 meters of broken terrain to reach a drainage culvert, who had sent search and rescue away twice before accepting help, and who had asked specifically for Lauren Merritt by name. Lauren hit the door at a walk, moving fast without running, the cold February air hitting her face as the ambulance doors opened. And the woman on the gurney turned her head and looked directly at Lauren with dark, exhausted eyes and a forehand gash that had been field-dressed with a piece of cloth torn from her own shirt. She said 2 words before anyone else could say anything. I remember you. Lauren didn't ask how, not yet. She asked the things that mattered first. What's your pain level, 1 to 10? 5. The woman's voice was hoarse, dehydration, cold exposure, probably some shock still working its way through. Maybe 6. Where's the 6? Wrist. The head stopped hurting about an hour ago, which I know means something. It means you're hypothermic and your nervous system is prioritizing. We're going to fix that. Lauren moved alongside the gurney as Rourke's soldiers wheeled it into the bay. What's your name? Nora Vass. Nora, I'm going to ask you some questions while we work. You can answer or not. That's your call, but I need you to tell me if anything gets worse. Nora Vass looked at her. She was in her mid-50s, Lauren thought, with the kind of face that had been striking once and was now something better than that. Specific, lived in, the face of a woman who had survived a number of things before today and knew what surviving felt like. Her hair was dark and matted with blood on the left side. Her hands were shaking but controlled. She was managing the shaking, not letting it manage her. You were at Mercer Basin, Nora said. It wasn't a question. Lauren held her gaze for exactly 1 second. Then she looked at the field dressing on Nora's forehead and began assessing it with clean hands. Hold still. 2014, the secondary aid station. There was a contract security team and a federal oversight unit. I was with the oversight unit. We came through after the action was over. Nora hissed slightly as Lauren probed the wound margin. You were the medic who stayed behind with the wounded when the helicopters couldn't land. I said hold still. I've been holding still in a drainage pipe for 3 hours. I can talk and hold still at the same time. Okafor appeared at Lauren's shoulder. He'd clearly been pulled away from something else and returned his attention here, which told her Rourke had flagged the incoming the way she'd been asked to. He looked at the wrist, at the head wound, at the vitals on the monitor one of the soldiers had already connected. Core temp? He asked. 94.1, said the soldier, monitoring the readout. His name tape said Briggs, moderate hypothermia. Okafor looked at Lauren. She needs active rewarming IV access, and I want a head CT before anything else. Agreed, Lauren said. The wrist can wait if the head clears. It'll clear, Nora said. I didn't lose consciousness. I've been oriented since I came out of the vehicle. You're telling me you crawled 300 meters through a collapsed bridge site with a broken wrist and a head laceration and didn't lose consciousness once, Okafor said, with the particular tone of a clinician who wanted the information to be true but was professionally required to verify it. I didn't crawl, Nora said. I walked, mostly. Okafor looked at Lauren. Lauren looked at Nora. She's telling the truth, she said. Get the CT. The CT cleared within the hour. No intracranial bleed, no midline shift, contusion to the left parietal region consistent with impact, nothing requiring immediate surgical intervention. The wrist was a displaced distal radius fracture, painful, eventually requiring reduction, but not immediately life-threatening. Her core temperature responded to warming blankets and warm IV fluids and climbed back to 96.4 within 40 minutes. What took longer was the conversation. Garrett came into the room where Nora was being monitored at 2:30, and he brought with him a woman Lauren hadn't seen before, civilian clothes, federal identification that she showed briefly and then put away, a bearing that suggested she was not accustomed to being told to wait. Her name was Special Agent Devin Marsh, she said, and she was the lead on the federal case that Nora Vass had been transported to testify in. Lauren started to step back. Give them the room, do what she was there to do, and leave the rest of it to the people with jurisdiction. Nora's uninjured hand came up and caught her wrist. Stay, Nora said. I'm not cleared for... I'm asking you to stay. Nora looked at Marsh. She stays, or this conversation doesn't happen in this room. Marsh assessed Lauren for about 3 seconds. Your clearance status? She asked. Inactive TSSCI, separated 4 years ago. Marsh nodded once, closed the door. What Nora Vass had witnessed and had agreed to testify about was not a small thing. Lauren had been around federal investigations before, and she'd developed a reasonable sense of scale. And this was not a small thing. For 11 years, a financial architecture firm called Gareth Lund Strategic had been systematically misappropriating public infrastructure funds across 4 states: Wyoming, Montana, Colorado, and Idaho. The money had come from federal transportation grants, state budget allocations, maintenance reserve accounts. It had moved through a series of shell accounts, contractors, and county-level administrators who'd either been paid off or hadn't been looking closely enough to notice. The infrastructure that didn't get maintained, bridges, overpasses, drainage systems, retaining walls, had been inspected on paper and signed off as compliant. The inspections had not happened, or they had happened and the reports had been falsified. The I-84 connector ramp had been on a flagged maintenance list for 18 months. The inspection that should have triggered emergency repair had been conducted by a contractor with a financial relationship to Gareth Lund Strategic. The report said the structure was sound. The report was wrong. Nora Vass had been the senior financial auditor assigned to the Federal Review of Gareth Lund Strategic. She had found the architecture of the fraud, traced it through 7 layers of institutional cover, and was 3 weeks away from testifying before a federal grand jury. "Who knew about the transport routing?" Lauren asked when Marsh had finished the summary. "Officially, 9 people," Marsh said. "Unofficially, we don't know. The routing change was made by someone with administrative access to the Marshal Service Coordination System. We're working to identify that person." "How long until you can confirm it?" "Hours. Maybe less." Marsh's voice didn't waver, but her jaw was tight. "The problem is that the people who set this up are not small actors. They have resources and they have contacts, and they have already demonstrated that they're willing to engineer a structural failure that kills civilians to prevent this testimony." The room was quiet. Nora was watching the window. Her wrist was splinted. Her temperature was climbing. The head wound had been cleaned and closed with steri strips that Okafor had applied with the fastidiousness of a man who took every repair seriously regardless of how tired he was. She looked better than she had coming off the gurney. Not good. Better. "They'll try again," Nora said. It wasn't a question. It wasn't even particularly emotional. It was the assessment of someone who had spent 11 years looking at how certain categories of people operated when their money was at risk. "We know," Marsh said. "What's the containment plan?" "You're safest here for the next several hours. We're staging additional federal personnel at this facility. Once we have confirmation on the routing breach, we move to a secondary secure location for the remaining pre-testimony period." "And if you don't have confirmation in several hours?" Marsh didn't answer immediately. That was an answer. Lauren stepped out of the room at 3:15 to check on the department and give Marsh and Garrett room to make their calls. The afternoon shift had fully taken over the floor by now. New faces, the cadence slightly different than the morning team. The incoming from the bridge site had finally stopped. What remained were the patients already admitted, already stabilized, already in the process of being managed by people who knew what they were doing. She stood in the corridor for a moment and let herself breathe. Her body had been running on the particular kind of adrenaline that old training produced. Not the sharp, panicked kind, the slow burn kind that turned off fatigue and dialed down the parts of the brain that were not immediately useful. She'd operated on that fuel in better-equipped places than this, and worse-equipped places than this. And she recognized the point in any crisis when it started to metabolize. The point when her hands were steady, but her knees wanted to disagree. She found a chair near the nursing station and sat in it for 4 minutes. 4 minutes was what she'd learned she could afford. Becca found her there on minute 3. "The 3 o'clock meeting," Becca said. "The administrator called it off. There are 2 people from the hospital board in with the administrator right now, and Sandra's in there too, and someone said there's a representative from the state health department." "What about Drelling?" Becca's expression shifted. "He's in his office. He came back about an hour ago, and he's been in there since. No one's seen him go in or out." She paused. "Someone saw him crying." Lauren absorbed that without visible reaction. It complicated nothing and changed nothing about what had happened, but she was human enough that it landed somewhere, found a small and inconvenient amount of weight. "What did you want to do with medicine?" Lauren asked. Becca blinked. It was an unexpected left turn. "What? When you decided to be a nurse, what was the thing you wanted to do?" Becca was quiet for a moment. "I wanted to work trauma. I wanted to be in the fast rooms where the actual decisions get made. I did my first placement in an ED and I knew that was the place. Why travel nursing? It was easier to get experience in different systems. I was going to settle somewhere eventually. She looked at Lauren. Why are you asking me this right now? Because you've been on this floor for 4 months, and you've been trying to read me for most of it. Lauren stood up. The 4 minutes were done. I'm an easier read than you think. Becca almost said something and then didn't. Stay in trauma, Lauren said. You're good at it. She went back to work. That's it. The second escalation came at 4:47. Rourke found Lauren in the supply corridor with an expression that Lauren recognized immediately as the controlled urgency face. Not panic, not excitement, the specific look of someone who has information that changes the current operating picture. The routing breach, Rourke said. Marsh got her confirmation. And? The administrative access that changed the transport route was traced to a terminal in the Callaway Peak Hospital network. Lauren went very still. This building? Yes. Whose terminal? Rourke looked at her. The access credentials belonged to Dr. Marcus Drelling. The corridor was cold and smelled like antiseptic, and somewhere 2 floors up there was a man sitting in his office who had been crying, and Lauren stood in the middle of all of it and thought very carefully for about 4 seconds. Drelling doesn't have Federal Marshal Service Network credentials, she said. No, but someone did, and someone accessed them from a device in his office using a credential spoofing technique that your average hospital administrator wouldn't know how to use. Rourke paused. The digital forensics team is running it now. Best case, someone used his office without his knowledge. Worst case, he's more involved in this than the falsified complaint. The phone call he got, Lauren said. This afternoon. Someone threatened his family. I know, Marsh has the number. What is it traced to? Prepaid, but the cell tower ping puts it within 2 miles of this hospital at the time of the call. That was not a small radius in Dunmore, Wyoming. 2 miles from Callaway Peak Medical Center covered maybe a third of the developed area of the city. But it also meant whoever made that call was local, or had been local, and had made the call after Rourke's team was already on site. Someone who knew the military response had arrived. Someone who was watching. Where's Nora? Lauren asked. Room 412. Garrett's outside the door. 2 of my people are on the floor. The patient board. Does her name appear on any exterior-facing system? Rourke's eyes sharpened. I'll check. Check now, Lauren said, and was already moving. Room 412 was quiet when Lauren came through the door. Nora was upright in the bed, not lying back, upright, the way people sit when they're thinking rather than resting. She had a hospital blanket pulled around her shoulders and a cup of something warm in her uninjured hand, and she was looking at the window, which showed a rectangle of late afternoon Wyoming sky going dark at the edges. Garrett was inside the room, not outside as Rourke had said. He was on his phone near the window. He looked up when Lauren came in, covered the phone's microphone with his palm. Marsh is coordinating the secondary location now, he said. We move at 6. Can you move it up? How far up? Now. He read her face. He put the phone back to his ear. Marsh. Change of plan. Nora watched this exchange with the calm of a woman who had been living inside someone else's threat assessment for months and had developed a particular relationship with urgency, neither terrified by it nor dismissive of it, just aware. What changed? She asked Lauren. The digital trace on the routing breach came back to a terminal in this building. Nora's expression didn't shift dramatically. Her eyes did. Something behind them recalibrated. How long have they had access to this hospital's systems? We don't know yet. If they had access to the routing system, they had access to the patient admission database. Nora looked at the door. They know I'm here. That's the working assumption. How long until you can move me? Lauren looked at Garrett. Garrett was still on the phone, listening, his face tight. He held up 2 fingers. 2 minutes, Lauren said. Nora put down the cup. She looked at Lauren with the directness of someone who has had 11 years of practice looking at complicated things clearly. You were the one who stayed, she said, at Mercer Basin. You stayed with the wounded for 6 hours when everyone else pulled back. Lauren didn't respond. I filed a report about that, Nora said. I included your name in the commendation section. I don't know if it ever reached anyone. It doesn't matter. It mattered to me. Nora paused. The men who were wounded. There were 4 of them. I looked them up afterward. All 4 of them were alive at the end of that deployment. Lauren had known that. She hadn't thought about it in the way Nora was framing it, as a fact with weight, as a thing that could be held and examined. She'd thought of it the way she thought of most of the things she'd done, as the next task, and then the next one, and then the one after that. We need to get you out of this room, Lauren said. She moved to the door and opened it. The corridor was quiet. One of Rourke's soldiers, a woman named Briggs, was at the end of the hall near the elevator. A second soldier, whose name Lauren hadn't learned, was near the stairwell door on the opposite end. The floor was otherwise unremarkable. Evening shift transition, reduced foot traffic, the particular settling down of a hospital as it moved from afternoon into night. Everything looked right. That was what bothered her. Lauren stood in the doorway and looked at the corridor for 3 seconds longer than she needed to look at it. She'd stood in enough doorways and enough places to know the difference between a corridor that felt right and a corridor that looked right. The two were different things. "Briggs," she said. The soldier turned. "The stairwell door," Lauren said. "Has it opened in the last 10 minutes? Briggs checked her watch. 43 minutes since the last foot traffic through. "Staff member, I logged her badge number." The elevator bank at the far end had 3 lifts. The center light was showing the elevator in transit. Descending, from what Lauren could read at this distance, which was not unusual, elevators moved. She watched it descend, past 4, past 3. It stopped at 2. Lauren turned back into the room. "Garrett, we're going now, not in 2 minutes." He was still on the phone. "Marsh says the vehicle is—" "We're not going to the vehicle bay," Lauren said. "We're going out the East Service exit. Do you know where that is?" "No." "I do." She crossed to the bed, offered Nora her arm. "Can you walk?" "Yes." "Then walk." They moved. The East Service corridor was the part of the building that patients never saw. Narrow, fluorescent lit. The paint on the walls a shade of institutional beige that had been chosen in a different decade for reasons no one could remember. It smelled like industrial cleaning solution, and the particular warm mechanical smell of a building's interior workings. Lauren had learned this corridor in her first month at Callaway Peak, not because she'd been directed to, but because she had always made it her first order of business to learn the exits in any building she worked in. Old habit, non-negotiable. She moved fast, but not running. Running attracted attention from anyone watching a corridor feed. Garrett was behind her, Nora between them, Briggs at the rear having followed when Lauren moved without waiting to be told it was the right call. They were 60 feet from the service exit door when Lauren's phone buzzed. Rourke. She answered without slowing down. "The patient admission database," Rourke said. "Vass is listed under her real name. Someone pulled the record 11 minutes ago from an external IP. We're at the East Service exit. I have a vehicle at the East lot. Gray SUV, my soldier driving, plates beginning with Hotel November." "Copy." She hit the door bar with her forearm and the cold Wyoming night came in hard. The lot was half dark, security lighting creating pools of yellow between stretches of shadow. She scanned left, right, found the gray SUV idling 20 meters away with its lights off. She also found something else. A man standing at the edge of the lot near the fence line, partially in shadow. He was not moving. He was looking at the service exit door. He had not expected it to open. Lauren held the door, looked at him across 30 meters of half-lit parking lot. He was in civilian clothes, no visible weapon from this angle, but the way he was standing, weight forward, hands not in pockets, was not the posture of someone who was in a hospital parking lot for a normal reason. They looked at each other for approximately 2 seconds. Then he moved, and she moved, and everything that happened next happened very fast. The man at the fence line made 3 mistakes in the first 2 seconds. The first was reaching into his jacket instead of running. The second was doing it slowly, the way people do when they've planned the moment in their heads, and the plan isn't matching what's actually happening. The third was not accounting for the distance between them being shorter than it looked in the dark. Lauren was already moving before his hand cleared his jacket. She crossed the space between them at an angle. Not straight at him, diagonal, The way you approach someone with a potential weapon when you didn't have one yourself and couldn't afford to give them a clean line. She got her hand on his wrist before he had the object out. It wasn't a weapon. It was a phone. He'd been reaching for a phone, probably to make a call or take a photograph, and the realization of that hit her at almost the same moment. Her other hand came up against his shoulder, and she had him turned against the fence with his wrist locked behind him. He was not a trained person. She could tell that in the first half-second of contact, the way his body responded to pressure, the instinctive flinch and tense rather than any kind of technique. He was in his mid-30s, shorter than she was by an inch, wearing clothes that were too thin for February in Wyoming, which meant he hadn't planned to be standing outside for long. "Don't move," she said. Not loud. Conversational. He didn't move. Garrett was beside her 8 seconds later. He had his sidearm out but low, aimed at the ground, his eyes scanning the perimeter rather than fixed on the man against the fence. That was correct procedure, and Lauren noted it without taking her attention off her subject. "Clear right," Briggs called from the door. "Clear left," the driver of the SUV called, having gotten out of the vehicle in those 8 seconds and moved to cover the other side of the lot. His name, Lauren learned later, was Specialist Dolan, and he was 24 years old and had been deployed twice. The man against the fence tried once to shift his weight, and Lauren increased the pressure on his wrist by exactly the amount necessary to make that a bad idea. "Who sent you here?" she asked. I'm a courier. I was hired to photograph a patient for confirmation of ID. I don't know who hired me." He was breathing fast, not from exertion, but from the specific hyperventilation of someone whose adrenal system had just received information it was not equipped to handle. "I got a call, they gave me a description, they sent me an address. I don't have a name. I don't have anything. I swear to you, I don't have anything." "What was the description?" "Female, 50s, dark hair, head bandage. That's all I had." Garrett moved up beside her. He was already on his phone. "Marsh, we have a possible surveillance asset in the east lot. Sending photo now." He took the picture, sent it, looked at Lauren. "She says hold him for the county deputies. They're 4 minutes out." Lauren kept her hand on the man's wrist. He was shaking now. Not resisting, just shaking, the involuntary physical response of someone who had walked into something they hadn't understood and was only now arriving at a full understanding of what it was. She felt something she didn't have a clean word for, not quite sympathy. More like the recognition that most of the people in this story, at every level, were not the primary authors of what had happened. Someone had built this, and other people had been placed inside it. That recognition didn't change what she did. She kept holding him. The county deputies arrived in 3 minutes and 40 seconds. Nora was in the SUV with the doors locked and Dolan in the driver's seat, engine running, while all of this happened. When Lauren got in, Nora looked at her with the same clear-eyed steadiness she'd had since the ambulance bay and said, "Was he armed?" "No, surveillance contractor, hired remotely." "They're layering their assets," Nora said. "That's how they've operated throughout. Third-party contractors, no direct connection to the principals. The financial structure was the same, always 1 or 2 degrees of removal from anything traceable." "Then why did the routing breach trace back to Drelling's terminal?" Lauren asked. Nora looked at her. "Because someone wanted it to." The SUV pulled out of the lot and Dolan took the long way around the building toward the street, avoiding the main entrance. Lauren thought about that for the 3 minutes it took to reach the secondary location. A county emergency management facility 6 blocks from the hospital, unremarkable from the street, which was the point. She thought about a complaint staged 3 days in advance. She thought about digital forensics finding credential spoofing on a terminal in Drelling's office. She thought about a man sitting in that office crying, and a phone call with a threat that had been delivered immediately after Rourke's team arrived and the situation began to unravel. Someone had needed a visible villain. Someone had spent a long time constructing one. The question was whether Drelling was entirely the construction, or whether he'd participated in his own construction somewhere along the way and then become inconvenient. She didn't have the answer yet, but she knew who did. The secondary location had been set up by Marsh's team in the previous hour. 2 agents already on site secured communications, a room that Nora could be comfortable in for the hours between now and the coordinated transport to the federal facility in Casper, where the grand jury proceedings were being held. It was not a comfortable room in any aesthetic sense. Drop ceiling, folding table, chairs that had been chosen for durability rather than any other quality. But it was secure, and it was warm, and it was not a hospital with a compromised network. Marsh was there when they arrived. She looked at Lauren with an expression that contained underneath its professional surface something that Lauren read as genuine relief, which she filed and didn't comment on. "The courier in the lot," Marsh said. "He's talking. The contact number he has traces to the same prepaid cluster as the threat call Drelling received. We're pulling cell tower data now to triangulate." "What's Drelling's status?" Lauren asked. "He's at the hospital. 2 of my agents are with him." Marsh paused. "He's cooperating fully. He's been cooperating since we made contact at 1400. Lauren..." She stopped herself. "Captain Merritt, the digital forensics on the terminal access are more complicated than the initial read. Tell me." The credential spoofing was sophisticated. Beyond what Drelling could have done, he doesn't have that technical background, and there's no evidence he contracted it. Someone had physical access to his office and installed hardware that allowed remote access to his terminal and his network credentials. Marsh looked at the table between them. "We found the device 40 minutes ago. It was behind the baseboard under his desk. It had been there for approximately 3 months. 3 months. Lauren ran the timeline backward. 3 months ago was before any of this, before the routing change, before the staged complaint, before the bridge. 3 months ago, someone had decided that Marcus Drelling was going to be the face of whatever happened when things unraveled. He was set up, Lauren said. Partially, Marsh said carefully. He was definitely manipulated. Whether he was entirely unknowing..." She stopped. "There are 3 communications in his personal email going back 8 months, with an account that connects to the Gareth Lund financial network. The content is ambiguous. He may not have known what he was communicating with, or he may have known and not known fully what it meant. What was in the emails? 2 were scheduling communications for a hospital board presentation about infrastructure funding in the region. The 3rd was a referral for a contractor. Drelling recommended a building maintenance firm for work on the hospital's structural systems. That firm has a documented relationship with one of Gareth Lund's subsidiaries." Lauren sat with that. Drelling in his office crying. Drelling handing her his phone with the ease of a man who needed someone to take something heavy from him. Drelling saying "my family" and not finishing the sentence. A man who had spent 11 years building a kingdom out of authority he protected by dismissing anyone who threatened it. A man who, at some point, had been useful to people who were very good at finding useful people. A man who probably did not know exactly what he'd been woven into until the moment it started pulling tight. None of that excused the complaint. None of it excused 11 years of a department run on condescension. But it made the shape of things more complicated than a single villain. And Lauren had enough experience with complicated shapes to know you had to see them clearly before you could deal with them. "What do you need from me?" she asked Marsh. "The timeline of this morning, on record, specifically the sequence of the suspension and the incoming MCY. We need to establish that the suspension was timed to remove clinical capacity at a specific moment." Marsh looked at her directly. "Your account of that sequence, supported by the hospital's internal logs and the system metadata we've already pulled, is potentially the clearest line we have between the Gareth Lund network and the deliberate engineering of the crash outcome. You think they planned for the hospital to be under-resourced. We think they planned for the hospital to be missing one specific person." Marsh paused. "You were flagged in their communications, not by name, by designation. The military asset at CPM. Someone inside the network knew your background, knew what you'd do in a mass casualty event, knew that removing you before the crash would affect outcomes." The room was very quiet. Lauren looked at the folding table. She looked at her own hands. She thought about Tyler in Bay 6, oxygen saturation climbing from 81 back to 96. "They were willing to let people die," she said. It wasn't a question. "They let 22 people die in structural failures over the last 6 years that we've attributed to deferred maintenance connected to this fraud." Marsh's voice was flat but not empty. "The bridge today. The preliminary count is 4 fatalities. We'll likely add 1 more before the night is over." Outside the window of the County Emergency Management Building, Dunmore, Wyoming was going about the business of a winter evening. Lauren could see the edge of a strip mall sign, a traffic light cycling through its sequence, the ordinary ambient light of a small city that had no idea how close it had come to losing its federal witness and its trauma-capable nurse in the same morning. "I'll give you the timeline," Lauren said. Well, she talked for 90 minutes. Marsh recorded it. A deputy IG named Castillo took handwritten notes in addition to the recording, and Rourke sat in the corner and said nothing, which was the most useful thing anyone in the room could have done. Lauren was precise. She didn't editorialize. She gave the sequence as she'd experienced it. The complaint meeting, the time stamps, the suspension, the exit, the sound of the emergency vehicles, the re-entry, the triage decisions, the arrival of the military team, the discoveries that compounded through the afternoon. She mentioned what she'd observed of Drelling's behavior without characterizing it beyond what she'd directly witnessed. She was careful about the line between what she knew and what she inferred, because that line mattered, and she'd learned a long time ago that crossing it in a sworn account was the fastest way to undermine everything the account was meant to establish. When she was done, Castillo looked at his notes and said, "One question. When you re-entered the emergency department and after the suspension, you said you told the security officer that he could remove you after. That's correct? Were you concerned about the legal exposure of that?" Lauren looked at him. "I was concerned about the patients." Castillo wrote something down. Marsh did not write anything, but her expression shifted almost imperceptibly in a direction that Lauren interpreted as satisfaction, which was not a direction she'd expected. "That's consistent with every account we've collected today," Marsh said. 15 staff members gave voluntary statements this afternoon. The phrases that appear most frequently are, "she just started working," and "she didn't ask for permission." A pause. No one used the word hesitate. Lauren said nothing. "For what it's worth," Marsh said, and then seemed to decide against the rest of that sentence. She closed her folder. "We're going to need you available for the next 72 hours. You may be called as a witness in the federal proceeding." "I understand." "The hospital. I don't have a job at the hospital," Lauren said. "I've been suspended." Marsh looked at her with the expression of a woman who had worked in federal law enforcement for long enough to recognize when someone was being precise in a way that contained a point. "I think that situation is going to resolve itself," she said. It resolved itself in pieces, and none of the pieces were clean. The hospital administrator, a man named Bernard Quill, who had the look of someone who had spent his entire career making decisions inside conference rooms and was now dealing with consequences that had moved decisively outside them, called Sandra Obi at 6:45 p.m. Lauren learned this secondhand from Sandra herself, who called Lauren's cell number from the hospital's nursing director line. "Quill is reinstating you," Sandra said, "effective immediately pending formal documentation tomorrow." "Did he say why?" "He said the state health department representative was very clear about the liability exposure of maintaining the suspension given the timeline." A pause. "He also said, and I'm quoting, that the board had some concerns about Dr. Drelling's situation that were going to require a full review." "What kind of concerns?" "The kind that come with federal investigators." Sandra's voice was careful. "Lauren, the emails they found in Marcus's account, some of them mentioned the hospital's infrastructure review committee. Marcus was chair of that committee. He approved 3 contracts in the past 2 years that are now under examination. Are they looking at him criminally?" "The investigators haven't said. He's cooperating." A brief pause. "His wife came to the hospital this afternoon. She sat with him in his office for 2 hours. I don't know what was said." Lauren looked at the wall of the county emergency management facility. She thought about all the forms that consequence takes and how few of them look like what you expect when you imagine justice. "Sandra," she said, "the nurses who were on this morning, Adrienne, Becca, the others, they did good work today." "I know. Make sure Quill knows." "I'll make sure Quill knows." A short silence. "Are you all right?" It was a simple question, and Lauren gave it a moment of genuine consideration, which was more than she usually gave it. "I'm okay," she said. "I'm tired." "You've been awake for how many hours?" "Enough. Come back tomorrow." Sandra said. "We need you back." The arrests came in two waves. The first was at 9:23 p.m., and it happened in a conference room at a financial firm in Casper, Wyoming, where three principals of Gareth Lund Strategic had gathered, apparently believing, until the moment federal agents came through the door, that their assets in the field had successfully neutralized the threat. Marsh's team had held the arrest warrants through the afternoon specifically to prevent any early signal reaching the firm. The three men arrested, Gareth Lund's managing director and two senior partners, had been in the middle of what the agents described as an operational review meeting. One of them asked to call his attorney before agents had finished reading the charges. One of them didn't say anything at all. The third, the managing director, a man named Warren Spade, who had built the company over 19 years and whose name appeared on civic foundation boards in 4 states, said he wanted to speak with someone who had authority to make a deal. He was told that ship had sailed. The second wave hit at 11:15 p.m. and reached into county government in 2 of the 4 affected states: administrators, 2 contract oversight officials, a budget committee chair in Colorado who had been receiving quarterly payments from a Gareth Lund subsidiary through a consulting firm that had never consulted on anything. Each arrest was coordinated simultaneously, preventing any communication between them after the first wave. Lauren was not present for any of these. She was at the secondary location, sitting across from Nora Vass, both of them drinking coffee from a machine that was better than the hospital's, but that was not a high bar. When Marsh came into the room at 11:42 and said simply, "First wave's done. Spade is in custody. Partners are in custody. County-level assets simultaneous 45 minutes ago." Nora put down her cup. It was a small gesture, quiet. The particular stillness of someone who has been carrying the weight of a thing for a very long time and has just felt it shift. "The grand jury," Nora said. "Reconvenes in 72 hours, Marsh said. "We have everything we need. Your testimony will be, it will seal it, but even without it, we have enough. You should know that." "I'm going to testify," Nora said. "I know. I want it in the record, all of it." She looked at the table. "All 22 of them." "It will be." Nora nodded once and picked up her coffee again. Her hand was steadier than it had been at the hospital. Not entirely steady. The wrist on the splinted side was immobilized, and the other hand still had occasional small tremors from the hypothermia and the cold, but steadier. Lauren watched her and thought about 11 years of following a thread through a labyrinth, and what it cost a person to do that, and what it said about a person that they did it anyway. Jose. At 12:40 a.m., Lauren was in the back of a county vehicle being driven back to her apartment. Rourke had insisted, citing something about operational security that Lauren was too tired to argue with, when her phone buzzed. Sandra. She almost let it go to voicemail and then didn't. "Marcus Drelling resigned," Sandra said, 40 minutes ago. "He submitted a written resignation to the board, effective immediately. He cited personal reasons." A pause. "He also sent a separate letter to HR, requesting that the formal complaint against you be permanently expunged from your record and that the department log reflect the suspension as administrative error." Lauren looked at the window of the vehicle. The streets of Dunmore passed by, quiet at this hour, a few storefronts still lit, the particular blue dark of a Wyoming winter night. "He didn't have to do that," she said. "No," Sandra said, "he didn't." She thought about what Marsh had said, the ambiguity of how much Drelling had known and how much he'd been used. She thought about how a man could spend a decade building something on condescension and still not be a murderer. She thought about how those two things could be true simultaneously without either of them canceling the other out. "The board is meeting tomorrow morning," Sandra continued. "Emergency session. The acting chief appointment will be on the agenda." She paused. "Your name is on the list, Lauren." "Sandra, I'm not asking you to decide tonight. I'm telling you it's there." A brief silence. "Get some sleep. You've been awake since, what, 6 a.m.? Something like that. Sleep. Everything else is tomorrow." Lauren ended the call and watched the last few blocks to her apartment pass in the dark. The vehicle stopped. Rourke's soldier, Briggs, it was Briggs again, waited at the curb. "You don't need to walk me up," Lauren said. "No, ma'am," Briggs said. "I'm waiting until you're inside." Lauren looked at her. Briggs was 26, maybe 27, with the kind of posture that comes from discipline rather than ego. She was doing her job and she was doing it correctly. "Thank you," Lauren said. "Thank you for today," Briggs said, simply, without ceremony. Lauren went inside. She was at her kitchen table, still in her scrubs, a glass of water in front of her that she hadn't drunk, when her phone buzzed a third time. Not Sandra, not Marsh, not Rourke. An unknown number. Different pattern than the prepaid cluster that the analysts had identified. This was a long-distance number, area code she didn't immediately recognize. She stared at it through 2 full cycles of the buzz. She answered. Silence for a moment. Then a male voice, older, unhurried, with the particular quality of someone who chose each word the way a careful person selects tools, not casually, not quickly. "Captain Merritt," the voice said, "my name is Aldous Crane. You won't know that name. You should know, however, that I have been aware of your name for some years, and I want you to understand something before the federal proceedings move forward." Lauren's hand tightened on the phone. She did not speak. "Warren Spade is not what this is," the voice continued. "Warren Spade is a useful man who became less useful when he became visible. The structure that Gareth Lund operated within is not a structure that ends with 3 arrests in Casper." A pause. "The woman you protected today, Ms. Vass, her testimony will be complete and accurate, and it will send several people to prison. I want to be clear that I have no objection to that." "Then why are you calling me?" "Because there is a second set of records," Crane said. "Records that Ms. Vass does not have, because they were generated in a layer of the operation that she was never positioned to see. Those records would expand the scope of this investigation considerably. They would reach people in positions that are, let us say, more consequential than a managing director and 2 partners at a regional financial firm." Lauren stood up from the table. She crossed to the window, looked out at the street, watched Briggs's vehicle still idling at the curb. "What do you want?" Lauren asked. "I want to give them to you," Crane said. She stopped moving. "I am not a man who loses," Crane said, and his voice was perfectly calm, which was more alarming than any other quality it could have had. "But I am a man who knows when a position has become untenable. The people those records implicate have decided, incorrectly, that I am expendable. I prefer to correct that assessment before they act on it." A brief silence. "I can have the records in your hands within 48 hours. Physical documents, verifiable chain of custody, cross-referenced against the financial data your federal team already holds." "In exchange for what?" "A conversation," Crane said, "with the right people, before any charges are filed that name me." Lauren was quiet. She looked at Briggs's vehicle. She thought about Marsh and Harwick and everything that had been built today on top of what Nora Vass had spent 11 years constructing. She thought about what it meant that someone with a different area code was calling her, specifically at 12:40 a.m. "How do you have this number?" she asked. A pause. Barely perceptible. "Captain," Crane said, "I have known your number for considerably longer than you've worked at Callaway Peak Medical Center." The line went quiet between them. Outside, Briggs's vehicle sat at the curb with its engine running, headlights casting 2 pale columns into the empty street. Lauren looked at the phone in her hand. She looked at Crane's number on the screen. She thought about what Marsh had said. Someone inside the network knew your background. Not Drelling's network, not Gareth Lund. Someone who had been watching her for longer than any of this. She thought about Mercer Basin in 2014 and an oversight unit that had come through after the action was over, and a woman named Nora Vass who had filed a commendation report that Lauren had never seen. And she thought about what Nora had said in room 412 before they'd had to move. "I don't know if it ever reached anyone. Reports went somewhere. Everything went somewhere. The question was always who was reading at the other end." "I'll need 24 hours, Lauren said, "and this conversation doesn't happen without the IG's office present." Another pause. Longer this time. "That is acceptable," Crane said. "I'll be in touch." She ended the call. She stood at the window for a long moment. Briggs's vehicle was still there. She picked up her phone and called Marsh. It rang once. "I was wondering when you'd call," Marsh said. She sounded awake, which meant she hadn't slept either. We picked up the number the moment you answered. We've been running it for the last 4 minutes. And a pause that was not quite as long as it felt. Lauren, Marsh said. The number traces to a registered lobbying firm with offices in Washington, D.C., and 3 other locations. Another pause. One of those locations is a federal building. A federal building, Lauren said. One of the locations, yes. Marsh's voice had that specific flatness that came from someone processing information they hadn't fully integrated yet. The lobbying firm, Crane Associates, has a registered office suite in the Wentworth Federal Annex in D.C. That's a building with mixed tenancy. Private contractors, consultants, some government adjacency. A pause. It's not unusual, but it's not nothing either. Can you trace the individual? We're working it. Aldous Crane. That name doesn't appear in our existing case files, which either means he's genuinely peripheral to what we've built, or he's been operating in a layer we didn't reach. A sound in the background. Keyboard, voices, the ambient noise of a team that had clearly not stood down. Lauren, what did he want? She told Marsh everything. The offer, the framing, the implication that Spade and the Casper arrests were one layer and that there was another layer underneath, with people in positions Crane had called more consequential. She was precise about the words he'd used because words mattered, and she'd learned that years ago in environments where imprecision had consequences. When she finished, Marsh was quiet for nearly 10 seconds. He wants to cooperate, Marsh said finally, in exchange for consideration before charges are filed against him. That's what it sounded like. And he contacted you specifically. Not me, not Harwick, you. Yes. Another pause. That tells us something about how he's assessed the situation. He thinks you're the leverage point, the person who, if she's on his side in the room, changes how the conversation goes. Marsh stopped. He's probably not wrong that you have standing here. Everything that happened today is documented and the sequence is clear. If you bring him in, it will carry weight. I know, Lauren said. You don't have to do it. I know that too. She looked at the window again. The street was empty now. Briggs had finally gone. She'd seen the vehicle pull away 2 minutes into the Crane call. The apartment was quiet, the kind of quiet that only exists at nearly 1 in the morning in a place where not many people are awake. Tell me about the second set of records, Lauren said. If they're real, how much further does this go? If the scope is what Crane implied, Marsh exhaled. Considerably further. The 4-state infrastructure fraud is significant, but it's not. It doesn't reach the level where federal building tenancy becomes relevant as a shield. If there are records connecting this to federal contracting at that level, we're talking about a much longer investigation and a much larger proceeding. More people who were paid to look away. Yes. Lauren thought about 22 people, the number Nora had said. 22 people who had died in structural failures across 6 years because maintenance funds had been redirected and inspections had been signed off on paper by contractors who hadn't visited the sites. 22 people who had been on bridges and in buildings and on roads that someone had decided were expensive to fix and profitable to neglect. She thought about Tyler, 16 years old, chest compressed against a steering column on a ramp that should have been reinforced 18 months ago. Set up the meeting, she said. IG's office, your team, and me. 48 hours. If the records are real, we take them. And if they're not, then we know what kind of man Crane is, and we proceed accordingly. She heard Marsh write something. Get some sleep, Marsh said. I'll have someone at your door at 7. I don't need 7 a.m., Marsh said. Please. Lauren ended the call. She stood at the window a moment longer. Then she drank the glass of water that had been sitting on the table, went to the bedroom, and was asleep within 4 minutes. It was not peaceful sleep. It was the dense, involuntary sleep of a body that had been running on emergency reserves for 17 hours and had finally been permitted to stop. She didn't dream, or if she did, she didn't remember. But the next 48 hours were not dramatic in any cinematic sense. They were the hours that followed the dramatic part, which meant they were full of paperwork and conference calls and the grinding institutional machinery of consequence catching up to events that had already happened. The board meeting at Callaway Peak Medical Center convened at 8 a.m. the following morning. Lauren was not present. She was in a county building 3 miles away, giving a recorded statement to Castillo and another deputy IG named Pruitt, who asked the same questions as Castillo but in different order, which she understood was intentional and answered the same way regardless of sequence. Sandra texted her at 9:47. Board suspended Drelling's hospital privileges pending completion of formal review. Acting chief named for interim period. They're holding the permanent position. Lauren read it, sent back a single acknowledgement. At 11 a.m., she was in the same room as Nora Vass for the first time since the secondary location, both of them in front of a federal preparatory team helping Nora organize her testimony for the grand jury. Lauren's role was peripheral. She was there to confirm the timeline of events at the hospital as they related to the transport and to identify anything in the sequence that intersected with the fraud network. She stayed for 90 minutes and said what she knew and left before the session became things she had no knowledge of. Nora caught her on the way out. She had a proper sling now, the distal radius fracture wrapped and immobilized by someone who had taken the time to do it correctly, and the gash on her forehead had been closed properly with sutures rather than steri strips, which improved things cosmetically without changing the underlying fact that she'd taken a significant impact to the head and was still showing up and doing the work. "I wanted to tell you something," Nora said. "You don't have to." "I know I don't have to." Nora looked at her steadily. "I've been inside this investigation for 11 years. In that time, I have dealt with federal prosecutors and law enforcement officials and forensic accountants and people with considerably more institutional power than a nurse from a hospital in Dunmore, Wyoming." She paused. "You were the person who made the right call yesterday, when the right call was the hardest one. I wanted to say that plainly." Lauren held her gaze. She thought about all the ways people offered recognition, the ones that were about the giver and the ones that were about the receiver, and decided that this one was the plainest version of the second kind. "Take care of that wrist," she said, "and drink water. Hypothermia pulls fluids in ways people underestimate." Nora almost smiled. Noted. Aldous Crane arrived for the meeting 31 hours after his phone call. Not 48, 31. He'd moved the timeline up by his own decision, which told Lauren something about the pressure he was operating under from whatever direction the people above him were exerting. He was 70, or close to it, with the physical bearing of a man who had spent decades in rooms where posture communicated authority. He wore a dark suit that was not expensive in an obvious way, but was expensive in the way that things are expensive when they're designed not to look it. He came with one attorney and no other staff, which was either a show of good faith or a demonstration that he didn't consider anyone in the room to be a threat to him. Lauren couldn't tell which, and she'd looked at enough people in her life to have a reasonable read. He sat across the table from Harwick, Marsh, Lauren, Castillo, and a woman from the U.S. attorney's office named Fleischer, who had said almost nothing since arriving and took notes in a system of shorthand that Lauren couldn't read from across the table. His attorney sat beside him and said nothing at all. Crane looked at Lauren first before he looked at anyone else. "Captain Merritt," he said, "in person." "Mr. Crane," Lauren said. She kept her voice even and her face neutral, which was not difficult because she'd been trained to do it and had practiced it in conditions considerably more stressful than a conference room in Wyoming. "I imagine you have questions about how I know who you are," he said. "I do," she said, "but I'd rather start with the records." He looked at her for a moment with an expression she couldn't entirely classify. Somewhere between respect and calculation, which were not always distinguishable. He reached into the briefcase at his feet and produced a bound document, approximately 2 inches thick, which he placed in the center of the table. He then produced a USB drive, which he placed beside the document. "Physical copies and digital with verified hash signatures," he said. "The chain of custody documentation is in the back section of the physical binder." He paused. "I would suggest starting with Section 4. Harwick reached for the binder. Fleischer leaned in. Marsh was already looking at her phone. She had someone on the other end ready to receive the digital files for immediate verification. Lauren watched Crane's face while the others looked at the documents. He was watching the room, monitoring reactions, the practiced attention of a man who had spent his career reading the temperature of tables like this. But there was something else underneath it. something that had the texture of a person who has been making a particular kind of calculation for a very long time and has recently decided that the calculation no longer works. "You knew this was coming," Lauren said quietly. Not to the room. To him. He looked at her. "I knew it was a possibility. What I didn't know was when." A brief pause. "When Spade authorized the bridge operation, he moved past a line I had not agreed to cross. That's not a moral statement. It's a practical one. Killing civilians and infrastructure failures is discoverable in ways that financial fraud is not." "People died," Lauren said. "Yes," he said, and something in his voice had no defense in it at all. "They did." Harwick looked up from Section 4. His face had changed. Not dramatically, but in the specific way that faces change when they encounter something they were looking for and weren't entirely certain they'd find. He turned to Fleischer. She was already nodding. "We're going to need a recess," Harwick said. The recess lasted 3 hours. Lauren spent most of it in a hallway with a coffee she didn't drink and a window with a view of the parking structure. She thought about nothing in particular for a while, which was unusual for her and which she permitted because she was tired in a way that went deeper than sleep could reach. Rourke found her at the 90-minute mark. "Briggs told me you thanked her," Rourke said. "She did her job well." "She did." Rourke leaned against the wall beside her. She was not a woman who leaned against walls casually. Everything she did had a deliberate quality, but something in the posture suggested that she was allowing herself, briefly, to be a person rather than a lieutenant. "The documents are real. The digital verification came back clean. Harwick's team is—" She paused, choosing the word carefully. "Energized." "How far does it go?" 3 federal contract administrators across 2 agencies, 2 senior officials in a transportation oversight department, and 1 person who is currently sitting on an advisory board that reports to the Deputy Secretary of Transportation. Rourke looked at the window. Crane built the architecture that made all of it invisible. He ran it for 19 years. He said Spade's decision to go operational, to start engineering accidents, was made without his authorization. We'll establish whether that's true. "Does it matter?" Lauren asked. Rourke considered the question seriously. "Legally, it will matter for his sentencing range. Morally—" She stopped. "No, probably not." They stood in silence for a moment. Outside, a van pulled into the parking structure and a family got out. 2 adults, 3 children, the children moving with the particular restless energy of people who had been in a vehicle too long. Normal. Ordinary. The kind of thing that was happening everywhere all the time while everything else was also happening. "You're going back to the hospital?" Rourke asked. "Tomorrow," Lauren said. "Sandra needs the department stabilized and I'm still on staff pending—" She paused. "Pending whatever the board does with the position." "What are you going to do?" Lauren looked at the family in the parking lot. The youngest child, maybe 4, was trying to climb the parking barrier and being lifted down by one of the adults, patiently, and then immediately trying to climb it again. "I don't know yet," she said, which was honest, and which was also, she recognized the first time in a long time, that not knowing had felt like an open door rather than a missing wall. The consequences unfolded publicly in the way that federal proceedings eventually do, not in a single dramatic moment, but in a sequence of press releases and court filings and news cycles that built on each other over days and weeks. The Casper arrests were the first thing reported. Warren Spade and the 2 Gareth Lunn partners were named, the charges detailed, the scope of the infrastructure fraud laid out in terms that local news could translate for audiences who didn't read financial law. The bridge collapse was the anchor. 4 deaths, a federal witness targeted, a structural failure attributed to deferred maintenance that was itself a product of systematic fraud. It was the kind of story that found purchase because it was legible. People understood bridges. People understood what it meant when a bridge failed. The second wave of reporting came when the federal contract administrators were named. That was the story that moved beyond Wyoming, that reached national desks and stayed there for more than a news cycle. 3 federal employees across 2 agencies, 1 advisory board member with a direct line to a senior transportation official. 19 years of a financial architecture that had funneled public money through shell accounts and compliant contractors, and signatures on inspection reports that had not reflected reality. 22 deaths attributed across 6 years to deferred maintenance connected to the fraud. The number appeared in every piece of coverage. Nora Vass had asked for it to be in the record, and it was in the record, and the record had become public. Lauren read the coverage in the break room at Callaway Peak Medical Center on the second morning back at work. Between a chest pain workup and a pediatric asthma case, in the particular 10-minute window that emergency department nursing occasionally produced when the board was briefly manageable, she put her phone down and went back to the floor. The formal board decision came on a Thursday afternoon, 11 days after the bridge collapse. They called it an emergency review and appointment, which was accurate. Bernard Quill delivered the offer in person, which Lauren appreciated. It would have been easier for him to send Sandra, and he hadn't taken the easier option, which told her something about how he was recalibrating. He sat across from her in the same conference room where Marcus Drelling had told her about the documentation gap, which Lauren noted and did not mention. "The board is offering you the position of Director of Emergency Services," Quill said. "It encompasses what Dr. Drelling held with expanded clinical authority over trauma protocol development and emergency preparedness." He paused. "There's also separately a request from the State Health Department for you to participate in an emergency response advisory panel for the region. That's separate from the hospital position. You can accept one, or both, or neither." Lauren looked at the table. "What happened with the formal complaint against me?" "Expunged completely. The suspension is characterized in the official record as administrative error." He paused. "That characterization is accurate. And the staff who worked during the surge, the nurses, the residents, they need recognition, formally, not an email." Quill nodded. "We've already begun that process. Sandra is coordinating it." Adrienne Salcedo identified a deteriorating TBY in Bay 3 during the surge that the attending had attributed to intoxication. That catch was mine initially, but she confirmed it independently. I want that in her record. Done. Becca, I don't know her last name, the travel nurse. Becker, Rebecca Becker. She should be offered a permanent position if she wants one. She worked trauma today like someone who was born doing it. Also done. Quill looked at her. There was something in his expression that she read as genuine, not performed contrition, not the careful liability management of an administrator navigating a legal situation, but the particular humility of a man who understood that something significant had happened and that his institution had been on the wrong side of part of it. "Lauren, the board wants me to convey that what happened here, the systematic dismissal of your capabilities, the environment that allowed Dr. Drelling's management style to go unchallenged for 11 years. These are institutional failures that this administration intends to address structurally, not just through personnel changes." She looked at him steadily. "That's a significant thing to intend." "I know. I'm going to hold you to it. I would expect nothing less." She looked at the table one more time. She thought about the morning 11 days ago, the conference room, the badge, the cold air on the sidewalk, the smoke rising in 2 columns over the highway. She thought about the things that had happened in the hours after that, and all the things that had happened in the 11 years before it that had made those hours possible. She thought about what Nora Vass had said. "You were the person who made the right call when the right call was the hardest one." The right call, Lauren had learned a long time ago, was rarely the one that felt easiest. It was usually the one that required you to know exactly who you were and hold on to that knowledge while everything around you was trying to convince you it was wrong. "I'll take both," she said. Post. 3 weeks after the collapse, the department looked different, not transformed. Real change in institutions didn't look like transformation. It looked like incremental pressure applied consistently until things that were wrong became things that were right. And even then you had to keep applying pressure because the drift back was always possible. But different. The board had brought in an external consultant to review the department's complaint process, and the results were not flattering, which was the point. 2 of the structural issues Drelling's management style had calcified into policy: the informal hierarchy that kept nurses out of clinical decisions, The practice of routing patient concerns through the attending physician rather than allowing nursing escalation were being addressed in concrete procedural terms. The nurses talked differently in the break room. That was the thing Lauren noticed most. Not louder or more confidently in some performed way, but with the specific ease of people who had seen what the department could do when it ran the way it should, and had started to believe that was possible more often than they'd previously allowed themselves to. Adrienne, whose TBI catch was now in her official record, had applied for the hospital's clinical leadership development track. Becca had accepted the permanent position, which meant Lauren had to learn that her name was Rebecca and that she'd come from an ED in Nashville, and that she had a dry, specific sense of humor that only emerged when she'd been on the floor for more than 6 hours. Tyler, the 16-year-old from Bay 6, came back to the hospital on a Tuesday afternoon with his mother. They asked for Lauren specifically. His mother was a woman in her 40s with the look of someone who had been frightened in a very permanent way and was still processing what it felt like for the fright to have ended. She held Lauren's hand for a moment without speaking, and Lauren let her, because some things don't have good words, and it's a mistake to try to fill the silence with worse ones. Tyler himself was more self-possessed than Lauren expected from a teenager who'd come that close to not surviving a car accident. He was tall and slightly awkward, and had the specific composure of a person who has had a genuine confrontation with mortality and emerged from it changed in ways he didn't entirely have language for yet. "They told me you decompressed my lung," he said. "Yes," Lauren said. "What does that feel like, from your end?" She thought about how to answer that honestly. "It feels like the most important thing you can do in that specific moment," she said. "And then it feels like the next thing." He nodded slowly. "My mom wants me to be a doctor now." "What do you want?" He shrugged. "Maybe. I don't know yet." He looked at her with the directness that certain young people have before life teaches them to look more sideways. "Did you always know what you wanted to do?" Lauren thought about that. She thought about the sequence of decisions and circumstances and moments of no good alternative that had taken her from a family in Billings, Montana, to a military recruiter's office, to a training program in Georgia, to a classified unit's medical team, to a deployment in a place she couldn't name in a conversation she was having with a 16-year-old in a hospital break room. She thought about the way things that look like choices from the outside often feel, from the inside, like the only available direction. "I knew what I was good at," she said. "I figured out what to do with it as I went." He thought about that. Then he nodded once, like someone filing information for later. His mother hugged Lauren before they left. Lauren held still and let it happen. Some things you let happen. Wookie. The grand jury proceedings lasted 4 days. Nora Vass testified for 6 hours across 2 sessions. Lauren was present for neither, she was working, but Marsh called her afterward and gave a summary that was professionally restrained and personally impossible to mistake. The testimony had been, in Marsh's words, definitive. The evidence package, which included the records Crane had provided under his cooperation agreement, had expanded the scope of the indictment significantly. Warren Spade entered a guilty plea on the 7th day after the grand jury closed. The 2 partners followed within 48 hours. The 3 federal contract administrators were indicted. 2 entered pleas, the 3rd chose to go to trial, which Marsh described as a decision she expected he would come to regret. The advisory board member resigned before charges were formally filed, which did not prevent charges from being formally filed. Aldous Crane's cooperation agreement held. He would serve time, reduced, but not eliminated, and the architecture he'd built for 19 years would be dismantled in a federal proceeding that would take longer than the criminal cases to resolve. He had known this when he called Lauren. He'd made his calculation, and it had been a calculation he could live with more than the alternative. Lauren thought about him occasionally in the weeks after, not with sympathy exactly, more with the acknowledgement that people who build large, harmful things often do it incrementally in ways that feel like pragmatism, until the moment when the pragmatism runs out. And what's left is the accumulated weight of all the choices that were made when better choices were available. She didn't think Crane was a monster. She thought he was a man who'd been very good at a particular kind of work and had let that ability serve as its own justification for a long time. She thought that was a more honest accounting than the version where people like him were simply evil. because the monster version let everyone else off the hook for not looking closely enough. The 22 people who had died on bridges and roads and in structures that should have been maintained were not restored by any of this. That was the part that didn't resolve, that couldn't be folded into the satisfaction of consequences landing where they belonged. Nora had asked for their names to be in the record, and they were in the record, and Lauren hoped it was enough, which was different from knowing it was enough, and she suspected Nora felt the same way. Marcus Drelling lost his privileges, his position, and eventually his license. Not immediately, but through the medical board review process that followed the federal investigation's documentation of his committee approvals. He cooperated fully with every inquiry. He was not charged criminally, which reflected the genuine ambiguity of his involvement. Used, partially willing, ultimately unable to be the person who'd been counting on him to look the other way long enough. He sent Lauren a letter. Physical mail, which she opened at her kitchen table on a Saturday morning with coffee she'd actually made rather than the hospital's. The letter was 2 paragraphs. The first paragraph was an apology, specific in its enumeration of what he was apologizing for. The systematic dismissal, the years of condescension, the complaint. The second paragraph said only that he understood she didn't owe him anything in response, and that the letter was not an attempt to negotiate that. She read it twice. Then she put it in a drawer and left it there, which was the right thing to do with something that deserved acknowledgement, but not a great deal more than that. Sandra knocked on her office door the same week the letter arrived. 6 candidates for the trauma team lead position, Sandra said, handing over a folder. I've done preliminary review. 3 are strong. Lauren took the folder. I'll look at them this week. Sandra didn't leave immediately. She stood in the doorway with the expression of someone who has more to say and is deciding how to say it. What? Lauren asked. The travel nurse, Rebecca. She asked about the clinical leadership track. Good. She should apply. She asked who was running the track. Sandra paused. I told her you were. Lauren looked up from the folder. I may have said that before confirming it with you, Sandra said. Sandra. You're the director of emergency services. Clinical leadership development falls under emergency preparedness, which falls under your expanded mandate, which I helped write. Sandra's expression was composed and entirely unrepentant. I believe the documentation is technically accurate. Lauren put the folder down. She thought about what it meant to be given something you'd always been capable of, but had never been given room to use. She thought about how you carried something like that. Not lightly, because it was heavy, but differently than you carried being underestimated. I'll talk to Becca about the track, Lauren said. Sandra nodded. She started to leave. Sandra. She turned. Thank you, Lauren said, for the morning of the collapse, for being honest about where you failed. Sandra looked at her for a moment. You don't thank people for the minimum they owe you. No, Lauren said, but I can recognize when someone does more than the minimum. Sandra nodded once more, the way she nodded when a thing was settled and left. On the last Friday of February, Lauren stood in the room where new clinical staff orientation was held, a conference room on the second floor with actual natural light, which distinguished it from most of the hospital, and looked at 11 faces. New nursing hires, 2 residents completing clinical rotations, a physician assistant fresh from a program in Denver. She had a slideshow. She hadn't used it yet, and she wouldn't. The person who'd made it for her had done it correctly, but it was the wrong format for what she wanted to say. She looked at the 11 people and thought about what actually mattered, not the protocol documents, not the certification requirements, not the administrative onboarding that they'd already sat through for 2 days, what she actually wanted them to understand. You're going to get it wrong, she said. That was how she started. No preamble. I don't mean that as a warning, see, I mean it as a fact. You're going to misread a situation, you're going to miss something, you're going to make a call that turns out to be the wrong call. Every single person who works in emergency medicine does, because we work in conditions where perfect information is a fantasy and time is always running out. She looked at them steadily. The question isn't whether you'll get it wrong. The question is what you do with the moment right after. A few of them were writing. Most were listening. The other thing I want you to understand, she said, is this. Being underestimated is not a reason to underperform. I know that sounds obvious. It isn't. When you work in a place where your capabilities are consistently dismissed, and you will work in places like that because those places exist and some of you are already thinking of one, the temptation is to either fight for the recognition or withdraw from the situation. Both of those are the wrong response. She paused. The right response is to keep doing the work. Not because the recognition doesn't matter. It does, eventually. It has to. But because the work comes first. If you do the work, the recognition takes care of itself. And if it doesn't, you've still done the work, which is the thing that actually matters. She looked at the faces in the room. Some of them were young, in the way that people are young before anything serious has happened to them. Some of them had things behind their eyes that said something serious had already happened, and they were here because of it, or in spite of it, or some combination. I'm going to say one more thing, and then we're going to go through the department, and I'm going to show you where everything is and how it actually runs, because the documents and the reality don't always match, and you should know the reality. She waited. Nobody saves anyone alone, she said. Not once, not ever. What happens in an emergency department is the product of every person who did their job correctly in every moment leading up to that one. The nurse who stocked the supply cart at the right time, the technician who calibrated the monitor, the person who updated the protocol that saved someone who didn't know their life depended on a policy decision made in a conference room 6 months earlier. She looked at them. You are part of a system. Your job is to make the system better than you found it. That's it. That's the whole job. She picked up the orientation folder from the table. Let's go see where you'll be working. She led them out of the conference room, down the hall, into the controlled, imperfect, necessary work of a department that was trying to be better than it had been. The corridor was bright with afternoon light. Someone was laughing at the nursing station. Not loudly, just the ordinary sound of people who were comfortable where they were. A monitor beeped. A phone rang and was answered on the second tone. The board showed 8 patients, 2 incoming, nothing critical. Just another day, which was Lauren had learned exactly what you worked toward. Not the extraordinary moment where everything aligned and someone recognized what you were worth. Those moments happened or they didn't, and you couldn't build a life around waiting for them. You built it on the ordinary days. The shifts that didn't make anyone's record. The decisions that no one witnessed. The quiet accumulation of doing things correctly because they needed to be done correctly, not because anyone was watching. That was the work. She'd been doing it for 20 years, in different rooms, different countries, different uniforms, and different scrubs, and she expected she'd be doing it for 20 more. The 11 people followed her down the corridor. She showed them where everything was.